Hi, welcome back to Naked Doctor. I'm Dr. Tammy, and today we are talking about functional medicine. And oftentimes when you think about functional medicine, you have to go to what's the root cause. And one of the most amazing things that I have come across is in the healing process, how does healing work? And healing works by using your own body's healing properties, stem cells, prostaglandins, anything that helps the body heal, and oxygen concentration to those areas. So your body has all its healing capability. The world of hyperbaric medicine is absolutely amazing. It's been around for more than 60 years, but what it does is hyper means more than, and baric is pressure. So it creates a pressure environment where oxygen can actually get into the cells. I think it should be used in every aspect of healing, strokes, Parkinson's, I mean, so many uses, as well as injuries, because what you need when you injure yourself is to increase blood flow to that area. So I personally had a GYN surgery a couple years ago, and what normally they say can take anywhere from 6 weeks to 3 months to heal from, I did 10 dives in a chamber and I was well within 2 weeks. So it's absolutely amazing what I've seen. I have had some people recently. I had a good friend with a burn on his hand after 3 dives. It was a 3rd-degree burn. Now, after a couple weeks, you can't, and this was only 3 dives, you can't even see where the blister was. I've seen neurological injuries, brachial plexus injuries with no movement and complete atrophy of the muscles, getting movement back within 3 days. So usually we recommend anywhere from 5 to 40 dives, depending on if it's a severe brain injury or what that might look like. There's so many indications for just short periods or sessions. We call them dives because it is much like the pressure when you go underwater. Some people are a little bit freaked out by that, but really all that feels is if you've ever dove before, you know that your ears pop a little and you feel that pressure, but you want to go down slow and come up slow so that they don't create too much pressure too fast. If you've ever been in an airplane, you know what that pressure feels like as it kind of builds in your ears. So it's just pretty much like that. So we have Jesse here today, and actually Jesse is one of our newest staff people here, and he's going to be running the chamber. And so pretty much what Jesse does is he makes sure to talk new patients through the process. It is a little bit of a tight area, so when somebody gets in there at first, if you're a little claustrophobic, it's always nice to have somebody who's kind and sweet with a calm energy to tell you everything's going to be okay. He checks in on the person very frequently when they get in as well to make sure that the pressure is not going too fast and causing any discomfort at all. And then watches while you're in the chamber too. And then when it's time to wake up, you can take a nap. You can even have a cell phone or something in there. You can, check Facebook or whatever you want to do, or take a book in there, take a nap. Actually, Jesse has a little bit of back injury. I'm one of the fight doctors, so I actually do fights. And so probably got a few slugs in the back from time to time. So we're going to start him on some sessions too, but he's agreed to kind of show you the process of getting in and getting back out as well. So you ready for this?
Yes, ma'am.
All right, awesome. So we're going to go ahead and get in the chamber. All right, kiddo, you good? You comfy? Usually it can be a little warm in there, but if you get cool, we'll put a little fleece pad in there to make you comfy, a little pillow under your legs, and make sure that they're feeling good in there. It's a little warm, especially till the air gets flowing. It's going to get really noisy here in just a minute, so I won't talk you through the whole process, but what I'm going to do is there's an oxygen mask in there. It's running about 8 to 10 liters, which is quite a bit of oxygen. Kind of creates that environment as if it was almost 100% oxygen in here. And that's why we call it Hyperbaric Oxygen Therapy, which is concentrating all that oxygen into the cells of the body, into the brain, into an injury, anything like that. So I'm going to turn on the oxygen in just a minute, and you'll just kind of see me walk through the process. But the next thing I'm going to do after I turn on the oxygen is I'll turn on the chamber. It's going to fill with air. This is the valve, and I'm going to let pressure off and to their comfort level, basically. And then I usually just have them put the mask on first, and then I'm going to start running the oxygen. Again, it's going to get really noisy. So. All right, kiddo, you want to check and make sure you got airflow there? You comfy? You okay?
Yep.
Okay. There's 2 zippers here, and we always make sure that we've got a really good seal on the zippers. People get a little nervous that they can't get out once they're in there, but the zippers do open from the inside as well as the buckles. And there is a release valve inside, so if they get uncomfortable, they can release it themselves, because sometimes people think if you're trapped, that doesn't feel good. So once we're buckled, then we just turn on the machine. So Jesse's at full pressure now. We're going to let him just sit in there for an hour. One of the Mayo Clinic protocols is that at about 20 minutes, we'll have him take his mask off for about 5 minutes. And that creates a state of what we call hypoxia, or lower oxygen. We're at almost 100% now. So then he drops down to sort of, room air oxygen. And then we'll have him put the mask back on, and that'll restore that full oxygen. And then what happens is, over the next 24 hours, the body will upregulate its stem cells. And the research shows that that can be up to 100-fold of increase in stem cells, which can become anything, and healing cells and recreate tissues, ligaments, tendons, damaged brain cells, anything that needs to be helped or healed, or from an anti-aging aspect.
When I was about 50 years old, I started gaining weight. I never suspected hormones. I didn't know what it was. I tried to cut back on eating. That really didn't work. And when I was about 58, I came home from work one day, and my husband had watched Dr. Tammy on television. He had never watched her before, and was telling me about hormones and what she was talking about and how it played into weight gain, and suggested that I visit her. And that was August 2020, and I did. And we did some blood work and she determined some hormonal issues and what we could try and what we needed to do. And I tried that. And along with her carb melt, I took that. And that was August 2020. And today, almost 2 years later, I have lost 27 pounds. And I feel great. I get compliments. People ask me, "What did you do?" And I always tell them about Dr. Tammy and the hormones and the carb melt. It seemed to be very effective for me. And I followed her diet plan. She had a small diet plan that I could follow, and I did. And I'm very happy. It's worked out great.
Hi, welcome back to The Naked Doctor. One of the amazing things about doing functional medicine is to have the opportunity to have it for myself. And one of the beautiful things about understanding this is also to know from the patient's perspective. So it's a wonderful thing. We are going to be doing something called PRF. And PRP is something that I've done for many, many years. It stands for Platelet Rich Plasma. And what we do is we draw the patient's blood, so I'm getting my blood drawn, and we draw the patient's blood and we spin it down in a special spinner, and it separates out the plasma from the red blood cells. And in something called the Buffy coat, right under that is what we call the platelet rich plasma. And platelets have an amazing healing property. So if you ever cut yourself and you have some healing that needs to happen, the platelets will go there, and they're like little plates, and they literally will plug the hole, right? So PRP has been used for many, many years, probably over 30 years in the US. And one of the ways it was discovered was we know that there's fibrin products and healing products as well as stem cells that come right from the bone marrow into the bloodstream. And when we can concentrate them, we can inject them into any area of the body. We have a new variation of this called PRF, which is Platelet Rich Fibrin. And I'm super excited about this process because it's just kind of taken us to the next level. And what this specific centrifuge does is it spins down in a way that it actually protects the fibrin and the stem cells. So it spins on a horizontal axis instead of like a regular centrifuge, like when we draw blood. And so when it does that on a horizontal axis, there's something called G-force, which actually pulls those red blood cells away without destroying the stem cells as it's moving through there. And so we let that spin. After it's spun down, we have a little process. We can actually make gel, just like hyaluronic fillers, for cosmetic purposes as well by using our cooler and our heater. And so we can heat it and then we could cool it down and it makes a gel-like product. And you can use it in the lips and the face. You can use it just about anywhere on the body that you need filler, cellulite, any areas where you're starting to have skin breakdown. So it's absolutely amazing. So it's been a wonderful process and we've helped so many people, joint pain, neurological conditions, just a vast array of things. Now we also do something called donor stem cells, which is what we call mesenchymal stem cells, which come from, not from embryos, so it's not like, they're killing babies or anything. I'm very clear about that. But it comes from cord bank blood and from placenta. So you've heard about cord bank storage. So we actually buy those mesenchymal stem cells and we can use them for just about every purpose that we use PRP or PRF now. We have lots of indications for using that in an IV for neurological conditions, for Parkinson's, for Lyme's disease. So lots of healing properties that go systemically when it's in the blood, put in through an IV bag, through the IV route. So we're spinning here, we got just a few more minutes on here, but when we take that out, basically she'll process it and then we can use it for the patient.
So honestly, they keep me level. I feel good. In those times that I have little dips of feeling tired or not on top of it, I can just reach out to them and they'll check my blood work and they'll tweak whatever needs to be tweaked. And I'm 57 and they just keep me feeling good. They offer so many services that helps me and my entire family. But sometimes I just feel ran down and I can call and say, hey, here's what I'm feeling. Again, they'll check my blood work, and today I'm just getting an IV that's got some vitamin C and some vitamins just to help me, feel better through the allergy season and just have some more energy. They are so personable. They're actually, I call them my family. They feel like my family. They really, really care about their patients. I have a great relationship with them. And that's so hard to find in this day and age that we live, to find someone that has an interest, whether it's 8 o'clock at night or if it's, 8 o'clock in the morning. I know that they're always there and I know they care and they really, really want me to feel better. And that's so hard to find. So I'm very, very grateful for that.
Welcome back to the Naked Doctor Show. I am talking about supplements in this segment. And one of the things that comes up the most in what we call traditional practice is people will say, hey doc, do I need vitamins? And first part of that conversation needs addressed too, right? And then the second part, the doctor says, no, you're fine. Okay, well, first of all, the term vitamins are essential. You have to have them, right? So what is actually in question is, do I need supplementation or do I need supplements? And it sounds like a subtle variation in the words and the terminology, but it's very important. So everyone needs supplements. I will say that again, everyone needs supplements. Why? Even if you ate from the Garden of Eden, there are still nutrients that you might be deficient in just genetically. And so that's one of the things that I do genetics wise, is we actually look down in your DNA and see what you might be deficient in. And then there's environmental, and that is a hot mess. Trust me, I mean, there's so much in the environment. There's pesticides that act like estrogens in your body. If you've ever been in the back of one of those chicken trucks, you see those chickens are like all breast. And I've talked to people who grow up chickens in the chicken factories, and they can literally grow a big chicken breast in less than 8 weeks or so. So you know there's so much hormone influence. You know that there's so much working against us, our food supply, processing, the chemicals that they put in there. So you've got to be able to counterbalance those deficiencies. One of the things that's happened in our food supply as well is that crops are supposed to be turned over every 7 years. And if you don't turn those crops over, you're not getting all the minerals and the vitamins and things that you need to get from the vegetables. So a lot of people are eating out, fast food, they just grab whatever they can, pizza for the kids when they get home, or chicken McNuggets. And so while there is quite a bit of nutrients that's being fortified back in foods, those aren't always the best nutrients. So you might have iron that's a metallic iron instead of an elemental iron. Your body can't use that. Or they might put in folic acid versus folate. Your body can't use that in most instances. And genetics wise, we process things differently. Some people are vitamin D deficient by genetics. And so that testing is really important, which kind of goes back to what testing is your doctor doing? Are they looking for nutrient deficiencies like vitamin D or B12 or vitamin C? Are they looking to make sure that your amino acids are balanced and that you're getting your coppers and seleniums and zincs and all the things that you need for your system to operate optimally? If you're struggling with chronic disease, if you're overweight, if you have any kind of disease process, it always goes back to some sort of deficiency in the biology, and at the very root of that is nutrients. When we go back to food as medicine, it's really important to get the right foods, of course, but supplementation, I promise you 100%, you have to have some supplementation. My son saw me the other day and I had a handful of supplements, and he said, "Mom, why do you have a handful of supplements?" And I said, "Baby, I'm in my 50s. I said, it's either this or a handful of pharmaceuticals." And that is the differentiation between what we call functional medicine and traditional medicine. It's not a pill for an ill. I always say a headache is not an aspirin deficiency. So there is some nutrient deficiency going on. There's some pathological process that needs addressed. And the question before the question is always, what's causing that? So I'm going to be a little brief here with some of the supplements we have in our office. And this is by no means comprehensive of the things that you might need, but these are just things that I found in my office that were constantly being needed, like vitamin D and things like that. So as I saw those things being needed, I wanted to make it more available. You can get these things online. You can get them from health food stores. You always want to make sure that your supplements are used with best practices and that there is good quality testing. And I've got a whole video on that about which supplements are the best and when you're actually getting what they say is in there, because some of the big box stores don't even have what they say is supposed to be in there. And so really the quality companies and the quality testing is what you want to go for. So I'm going to come back to this guy just a minute, but joint support. So things like MSM, glucosamine, if you have joint pain, it's not an aspirin deficiency, it's not a pain med deficiency, it's a nutrient deficiency. So having things to support your joints, and a ton of stuff in here, your seleniums, your zincs, all that stuff that helps bone density, your calciums. So joint support, very important. Vitamin D, can't stress enough. We are extremely deficient vitamin D society. We stay inside on our computers a lot. And if you have a genetic deficiency, people are like, well, I spend a lot of time in the sun. But if you have a genetic deficiency in the way you process vitamin D, just for example, it goes through the skin to the kidneys, through the liver. So it goes D1, D2, D3. That's why we take D3. So if you can't process that genetically, then you're going to always be deficient, and then you're going to always need to take extra D3, right? Brain support, absolutely love this stuff. This is a product that has ginkgo biloba in it and many other nutrients and supplements and MSM and DMAE, and I won't go into all those, but a good ginkgo or a good memory support is really important, especially as we're aging. In fact, some people just came in this morning to get some of this because they said, I tried it, didn't know it was doing that much, but when I ran out, I really noticed, they said they would memory word recall or walk in a room and forgot what they said. So this can be really important too. Fish oil, love fish oil. If you have any chronic inflammation, fish oil, the different EPAs and the different molecules in there actually can decrease the inflammation through their prostaglandin pathways. This is as powerful as ibuprofen or any of the NSAIDs. The difference is it's healthy. It won't tear up your stomach. It won't cause GI bleeds. So again, one thing you want to consider when you're starting any supplement is check with your doctor. So I love fish oil. It's a great anti-inflammatory, but what I was going to say about that is it can be a bit of a blood thinner. So if you're on medications like blood thinners, again, that's why you're going to have to do your research before you talk to your doctor. You need supplements, but you want to make sure that you're doing it safely. Candida is a huge problem. I see this all the time in people with chronic disease, chronic GI issues, irritable bowel syndrome. The yeast overgrowth can be incredibly high, and so we actually have blood testing that we can do. Traditional doctors can do that too, but you can test for candida in the system, and you normally have bacteria and yeast all the time, but when the yeast overgrow, it can cause anything from GI problems to brain fog to hormonal imbalances. So we have a little bit of a yeast support here. Moving right along, a lot of B vitamins, B complexes, they're so important for all your metabolism. We've got the L-methylfolates. Genetics-wise, there's some conditions like MTHFR, tons of things that can happen in your genes that you need the right supplement. So I'm just going to kind of briefly throw that out there. Folic acid is not the same as methylfolate. Methyl groups actually help remove toxins from your body in a process through your liver called methylation. Your liver is everything. Your thyroid is converted mostly in your liver. Your female and male hormones are converted in your liver. You have to protect your liver. And speaking of that, I haven't private labeled or private formulated a liver support, but this has things like milk thistle and dandelion and things that will really support the liver. So you have to take care of your liver. And most doctors will say your liver's fine unless your liver enzymes are extremely out of whack. The liver is very regenerative, so it has to be really, really sick before it starts to show up on blood work. So there's so many processes that happen through your liver. You really have to protect it and take care of it. Kind of interesting too, you know, I don't recommend drinking alcohol. It is a toxin. But if you do drink alcohol or a glass of wine, which, you know, I like to do that every once in a while, protecting your liver is really, really important because your health is so dependent on the liver. A lot of doctors don't even recognize the liver or the adrenal glands unless you're really, really sick. So just taking that proactive, or if you do drink alcohol occasionally, or if you do take, you know, in too many toxins or work in a toxic chemical type environment, you really have to protect your liver. And then I love collagen. This is a collagen powder. This is really good for joint issues. I honestly take it for the old lady crepey skin, and I put this in my protein shakes, and it's made a huge difference. As well as the hyperbaric oxygen chamber, I will say too, from an anti-aging standpoint, my skin has never looked better as it has these past few weeks since we've had the chamber. Again, a good B complex. Vitamin C, hugely important for your immune system. We've seen a lot of viral type infections this year and immune system attacks. So vitamin C is critical. I met a lady one time and she had great skin and she was in her 40s and I was in my 20s. And I said, "What's your secret?" And she said, "Vitamin C. I take like 4 grams a day." So very, very important for your immune system and your skin and every level of having antioxidants and disease prevention. So a little interesting thing about this too, if you've ever heard of scurvy, the people on the pirate ships that were out, I never realized these people were out to sea like 4 years at a time without even seeing land. And they had no citrus, they had no vitamin C support. And so they would get their teeth, their gums would bleed, their teeth would fall out, they'd be all bruised, they would just basically disintegrate in front of your eyes like a prison victim or something. But we call that scurvy, right? So it's a vitamin C deficiency, but we also call it a subclinical, meaning not quite full-blown teeth falling out, but a subclinical scurvy with vitamin C deficiency. So if your gums are bleeding or if you bruise easily, you probably have vitamin C deficiency. Again, if you have other conditions like kidney stones and things like that, you do have to be careful with some of these supplements, but it is about balance too. So I'm not saying you don't need those supplements. I'm just saying that if you're on certain medications and things like that, that could interact, it's an important thing to do your research first. I love this. This is Dim Cream, and I just get this on the internet. It's from Biolabs Pro. This is an estrogen blocker basically for people who have something called estrogen dominance, both men and women. This is great for cellulite though, and I have a whole nother show on cellulite, which is great. You'll want to find that, but you can actually rub this on your cellulite areas and it'll decrease the estrogen stimulation to the skin breakdown in those areas. So love this stuff. One of the things that really drives people into my functional medicine practice is weight loss. So I have a very in-depth understanding of the nutrient support that goes with hormone balance at the level of the DNA. But one of the things that comes up with weight loss is something called insulin resistance. And insulin is your sugar storage hormone. So I actually put this together to help balance carbohydrate metabolism hormones. But when I said, what is insulin resistance? Why are people storing all these carbohydrates? Why are their adipocytes or fat cells swelling? And why do they look obese or inflamed or overweight? So I put this together. I won't go through all the ingredients here, but the main ingredient is something called white kidney bean extract, which can help block the breakdown of complex carbs into simple sugars, which then get stored as fat. And then I also made something called belly melt. And sometimes people are confused because they're like, why do I need two different things? Well, it's two different hormone pathways. So if you know that you have a carbohydrate craving issue, or that when you eat carbs, you tend to bloat and gain weight after that, then that's a great product. And then belly melt, people had a lot of what I call adrenal fatigue. The adrenal glands are very important, and belly melt helps support the adrenal glands, which make the majority of your cortisol, which we know cortisol belly, right? So if you want to address belly, cortisol issues as well play into this. But if you really want to go for, the belly fat and those kinds of things, because cortisol as a imbalance can cause a lot of weight issues around the center. So I hope this helps you understand supplements a little bit more. We're gonna take a little break and we'll be right back with the Naked Doctor. Hi, welcome back to The Naked Doctor. I'm Dr. Tammy. This has been a wonderful show, and it's probably because it's one of my favorite topics, functional medicine. There are things that come along that I learn about, like red light therapy, which can help heal deep tissues and can help with all sorts of different conditions. Radio frequency devices, a lot of this can be for aesthetics as well, which I absolutely love. So there's so many aspects to more non-traditional approaches, and food sensitivity testing we do, and all sorts of things to get to the root cause of leaky gut, which pretty much causes all autoimmune conditions. So functional medicine really is about the long-term play and getting better and taking control of your metabolism. Check us out at thenakeddoctorshow.com. We have the healingartcenter.com as well, and you can learn more about some alternative things that you can add. Check us out. We've got Facebook page, Instagram, Twitter. We're everywhere. So you can just search for Dr. Tammy. You can search for Healing Arts or The Naked Doctor Show. Okay, we'll see you back here next week on The Naked Doctor. Love you. Mwah.